Hi, everyone. I am Camellia, a psychiatric mental health nurse practitioner, also known as a PMH NP. I'm also a nursing and mental health enthusiast. And I am getting on today. I know, guys, I have not been on in a while. First, let me say that. Secondly, thank you for all of those who have recently subscribed, all of you that have recently reached out to me by the different means of communication, by email, by the form that I have here on the channel. You guys have had some really great questions. Most of you, many of you are on a very rewarding path to becoming PMHNPs or switching in jobs. So I've talked to a fair amount of you about different points of your career. So thanks for those questions. Thanks for the comments. You guys keep them coming. And I look forward to continuing to engage with you guys. I have not been on here in a while, but today I wanted to talk about a topic that's not necessarily an elephant in the room, but it is something that is less talked about in nursing and in this field of being a nurse practitioner. And that is really preparing yourself to transition from being a nurse to a nurse practitioner. So I have, shared my insights, shared a little bit of my thoughts around being a nurse before becoming a nurse practitioner. I talked about, before a couple videos ago, whether, there's about the number or years of experience that could be recommended. However, I do want to say that, nursing, being a nurse or bedside nurse to becoming a nurse practitioner, should not be measured as apples to apples. And I think a lot of people go into this thinking that being a nurse practitioner is just sort of an extension of being a nurse. However, I will say that we have to see it more as layers of healthcare versus seeing it as a true linear transition, because the roles look much different, as I've referenced before. It's very important, in my opinion, for you to have some level of healthcare nursing experience so that you can acquire specific skills, so that you can have knowledge around particular things, which sets you up for a good foundation to be able to learn on a more complex level and an advanced level when you become a nurse practitioner. So I do think there are highlights to becoming a nurse first, but I want to specify here that it is not a linear transition. And there are challenges that come with the transition. And so I just want to talk about a little bit of that today, but of course, end by offering maybe some tips that you guys can consider, or things that you guys can consider if you are sort of in this period of time where you have just become a nurse practitioner, or you're a nurse and you're a nurse NP school, or you're considering becoming a nurse practitioner. So there are some things that we'll talk about. Imposter syndrome is real. So I like to bring that up first and foremost, because most of us in nursing, as many do in any area that they have not worked in, or just starting out in, the traits of imposter syndrome can show up, right? It's just not being as confident with what you're doing. I can say that I experienced that as a nurse. Was a nurse for 11 years before becoming a nurse practitioner. And I definitely had more bouts of it again as a nurse practitioner. So definitely just want to highlight that the transition is not linear, but you also are not going to be going from a proficient nurse, no matter how many years of experience you've had, where you've worked, what populations you've worked with. You're never going to go from a proficient nurse directly to a proficient nurse practitioner. And it's because those roles are so different. And I would say a few things to think about personally as you are preparing for this transition is, one, be sure that you are prepared from a foundational perspective. So that could mean your experience as a nurse. but that also could mean your preparation for becoming a nurse practitioner. I have talked a lot about this in other videos, the importance of really vetting out a good nurse practitioner program that is going to guide you, teach you, and also set you up for the best when it comes to you actually practicing as a nurse practitioner. Okay, so again, you are a provider, you're under that umbrella, so you have more of an authoritative role as a nurse practitioner. And so you have to be able to function as such. So I would say that preparation is key. That starts with the program. Also personally assessing where you are. So are there weaknesses? Are there areas of growth for you? Do you have imposter syndrome as a nurse and you're going back to school to become a nurse practitioner? I think it really is important for you to point where you are on your journey, what you're feeling about your success, what you're feeling about what you've accomplished, and where you feel like you are on that spectrum of confidence and competence. I think we all have to continue to assess ourselves as it relates to that. I still do that 5 years into this career as a PMHNP because it's important. It's important to understand, are there other areas of growth? Are there other areas that I'd like to pursue? And just being sure that you are preparing yourself, giving yourself the different things that are resources that are in place to really help you to continue to grow. Okay, so some of that is taking back your own control of what you have, what you can manage, what you can do to help improve areas that you may not feel as confident in, and also not putting it back on your years of experience or not putting it back on just the program that you attended. So this growth pattern is definitely progressive as you become a nurse practitioner. And so I think the willingness to be able to continue learning and growing is definitely necessary. Okay. Setting realistic goals with yourself. So again, you're not going to go from a proficient nurse to a proficient nurse practitioner. So I think it's important that you set realistic goals around your patient care, around starting a new job, and understanding that there is a learning curve. So I think if you have an understanding and an awareness of that initially, but also you set realistic goals for yourself, something that's not unachievable, but it's a feasible goal that you can actually set. And once you feel confident around that goal, then you can move forward and continue sort of building from there. But sometimes we set ourselves up for discouragement because our goals are not realistic. So I think that's really important here. Also, understanding, as I said, that this is more, as a nurse practitioner, you're in more of an authoritative role. I will say I struggled with this significantly, at least my first year of becoming a nurse practitioner, where I was still functioning in the mindset of a nurse, where I wanted to carry out all the tasks. I wanted to do all the things that were necessary for the patient. And I struggled significantly with delegation. So I think one of the things that we have to be able to learn how to do as you are in a leader position, inevitably as a nurse practitioner, you are going to be a leader. So you're going to be overseeing tasks, things that you are ordering. You are going to be doing that. So you have to be willing to accept that role. But I also think that there is a slight transition from the mindset of, I'm going to do this task and carry it out versus I'm going to be sure that this task gets done and I'm going to order what's necessary for the patient. I will say, as I said, I struggled with this initially because I wanted to still do vital signs for my patients. I wanted to still, do a lot of the things that were not still within the scope of me being a nurse practitioner, but that could be delegated, particularly when you have staff in place that are responsible and well qualified to do those things. So it can be a recipe for burnout, I should say, if you are not in a space and you don't learn to be able to delegate and function more from sort of an authoritative role where you are overseeing the care, but you're also able to think from a more complex level to be able to care for patients. Okay. And also, one of the real important things that I think about being a nurse first is that you appreciate the role, and you understand when you're working with staff how that looks, what that seems like, what that feels like. And so for me, it's actually helped me to have a great relationship with nurses that are carrying out the tasks or the orders, or medical assistants. I've worked with a lot of great, excellent medical assistants, and it's really I've really learned, how to communicate with them in a way that they appreciate. So I think there's definitely value there. Another topic, but definitely some value. Okay. I also want to say that it's important from a personal perspective to remember your why. This seems like a cliche sort of statement, but I don't think it holds any less significance as a nurse practitioner as you're transitioning from a nurse to a nurse practitioner. That you remember why you're doing it, and that also drives your motivation. That also drives you wanting to grow. It also drives you wanting to continue to serve patients in the best way possible and have the level of knowledge, the competence level to continue growing so that you can do that and provide excellent care for your patients. So I do think it's very important that you tap back into why am I doing this on a consistent basis as you transition from a nurse to a nurse practitioner, and understand the value and in the value in going back to that, to your foundation. Okay. A few other practical things here that have been offered in various places to help with this transition from a nurse to a nurse practitioner. I would say this may also fit under the personal side of it, but maybe seeking out mentors. Mentors are great resources who are usually willing to continue to help support you along your journey. And they're a little different than preceptors. Preceptors are designated for the clinical area. You may encounter preceptors in nursing school and as a nurse practitioner when you're doing your clinicals. However, a mentor is someone usually outside of that area, that clinical area, who may practice as a PMH&P or a nurse practitioner, who can also give you sort of this ongoing support as you continue to transition. So I do think that can help mitigate some of the challenges that come with the transition from a nurse to a nurse practitioner. Also, just setting yourself up with great supervising physicians. I can say for myself that I've gleaned a lot from some very great teachers who have been supervising physicians, but also have been willing to support me along the way, have been available to answering questions. I do think that there is great value there as well as you make this transition. And lastly, one of the things that I know had started to exist when I was at the bedside was residency programs that actually are now in place for nurse practitioners. So there used to be a lot of focus on residency programs, in particular specialty areas of nursing where nurses have, both didactic and clinical experience that they go through for a series of months. And basically it's just to help them make this transition. So there are definitely some organizations, depending on where you're seeking support or seeking a job, that have nurse practitioner residency programs. So I do think that could hold a lot of value for you as well. Okay. I've talked about quite a few things here. I know that there are other things that I've not really opened up today in terms of the transition from being a nurse to a nurse practitioner. But I'd love to hear from you guys. What have you experienced? What are your challenges? What are your fears if you're a nursing student right now and you're thinking about becoming a nurse practitioner? I'd love to hear from you guys. Ask me any questions as well. And I look forward to seeing you guys in the next video.